Hi, I'm here with my very good friend and colleague, Dr. Michael Kucera. He has developed expertise in mitochondrial medicine over the last really 20 or so years. He's an expert in what we can loosely call bioregulatory medicine, autonomic nervous system assessment. And the amazing thing about these developments of his are that they're broadly applicable to a broad range of different diseases. So today, because of Michael's work in particularly in pervasive developmental disorders such as autism, Asperger's, etc., we want to talk particularly on this topic, and I want to explore with Michael some of the incredible results that he's been achieving with his mitochondrial support. So, Michael, in reference to autism and pervasive development disorders in general, can you explain a little bit how this works?
Basically, we can see two levels of problem with these disorders. First level is cellular level. It's approved and scientifically documented that every this pervasive disorder suffering from mitochondrial disorder. What does it mean? It means that mitochondria are not producing sufficient energy, and more, this production of energy is not under control of center. So it means sometimes it is out of control, so lack of energy, sometimes increased energy production from nothing, without any control. So it means that that is why we used to say disorder. It's not only reduced capability to produce energy. The energy is very important not only for life of cell, but also for the function of the cell, and that is the problem. So first level is mitochondrial disorder. Second level is control level. So it means that every organism comprising a system which is controlling in an environment, behavior, controlling so-called homeostasis, so the stability of in the environment, reaction to outer environmental, so stress and adaptation to stress, and activity of hormonal and immune system. Here we can see by these pervasive disorders, we can see that this control is not functioning. Okay. So this is the most important problem, cellular level and control level.
Okay. So how can you measure this mitochondrial energy in these control systems that you're talking about?
We are not measuring directly energy. We are measuring by method of so-called heart rate variability analysis. We are measuring efficiency of this control system. So it means this control system is responsible also for control of energy production, to choose what energy will be used from sugar, from fat, and so on. And this control system is failing, but we are measuring it. So we know how is total power of system, how percentage is direct energy and hormonal and immune system efficiency, how efficient is cardiovascular sympathetic center, and of course we can see how is autonomic vegetative system working. So it means that, and we can see that by these pervasive disorders is extremely out of control, so extremely low total power, total efficiency of the control system, production of energy, and more we are measuring also stress, and by these patients we can see very extremely high stress without adaptation capabilities. So that is why they have panic, anxiety, aggression, automutility, and so on.
So these measurements you're achieving on this heart rate variability equipment reading, which takes what, about 1 or 2 minutes to
around it, from half to 2 minutes.
Half to 2 minutes. And it's a short period because you're usually dealing with restless
Yes, standard.
children
Yeah.
who won't stay still for a longer
Yeah.
period of time. Okay.
That is problem because of course we need very carefully and highly specialized view and analysis to do for these children. It is not easy because there are some mathematical law how to correct the, for instance, movements of the unquiet baby patient, how to cancel and correct this artificial rushes of the recording and so on. And it's very, very complicated, not easy, and must take a study around 2 years until good analysis for autistic children is possible to review.
Okay. So one of the things that you've done over the years is you've developed these mitochondrial support supplements. Can you talk a little bit about the specific improvements that you observe in autism using these supplements?
Yes, of course, we can see that after using this combination of supplements, we have two basic supplements. One is Karnozin complex, or second is Q10 complex. It should be every time with some combination, which is responsible to bring the active substances into the mitochondria and into the cell. But it is not so easy to find out because so it means it is very unique combination of diet supplements which is really working. It's really functioning, this combination. But results are, so we can see first by information from teachers, parents, we can see the improvement in socialization. They are finding friends because autistic children, they are living without any friend. They are not also doing social interaction with brother, with sisters. Absolutely, they are living absolutely solo with high stress. So it means we can see improvement in social communication, less of aggression, because escape from this panic is aggression, also aggression to themselves, so automutility. We can see less and less slowly, it is not from day to day. Yes, slowly improving development of speech. Many autistic children are not speaking at all, so we can see development of speech. And the most important is the social behavior, social communication, socialization and all. They are starting to find friends, they are playing with the brother, with parents and so on. So they are not ignoring the outer environment like before.
Amazing.
This is really, really unbelievable.
And how long would they normally have to take supplements before you see
So
positive results?
first is necessary to know that how we discovered the effect of the supplements is developing in 3 months. So we know autonomic nervous system, or this autonomic regulatory system, is biorhythm is 3 months. And when using these supplements, first month is so-called activation phase, and it is necessary to know in this first month to instruct the parents that sometimes temporarily this autistic children can be more aggressive, more nervous, more agitated, but it will disappear. In second, when it's hormonal metabolic phase, it's starting to be more quiet and slowly develop. But full effect is after 3 months. And after 3 months, starting to work on the system. So it means first 3 months, we are only starting the process. First 3 months, we cannot expect some big changes, but after 3 months, it's starting. So minimum is half a year, minimum. And we can say that average improvement is from half a year to 3 years.
Okay. So I'm right in saying that most of your work with autistic patients is not in the UK. It's in Czech and Serbia, Germany, etc. So just roughly, I know it's a difficult question to answer, but you've seen thousands of patients over the years. Roughly, what sort of percentage would you say you see improvements in of those thousands of patients you've treated?
With
roughly.
this, roughly around 80%.
So it's very high.
Yeah.
Okay.
But improvement generally, so it means not fully improving, partially, but around 80% improving the social interaction. So better school. Some of them can live in school without assistance. So around 80%.
Okay. So and how does your treatment compare? Well, I shouldn't say treatment, but how does your supplemental support? How does it compare with a treatment like Ritalin?
What I need to say, the Ritalin is the only one helping drug. That's right. But it's improving. They are more cool, more calm. They are more attentive in the school and so on. They are slightly improving the social interactions. But in the other, so they are more quiet. But other improvement we cannot recognize by this Ritalin. So it means that it is very good for the parents that the child is more calm and more quiet, and we can say better to educate. Yeah.
Yes.
But improvement I didn't see. Of course, I have many of patients. They were using Ritalin. After starting the supplementation, was improvement, huge improvement, and slowly Ritalin was possible by the recommendation of the responsible doctors, neurologists, psychiatrists, was X, yes, so not necessary to use further. So they were after that without Ritalin.
Fantastic. So lastly, Michael, could you maybe just talk about some examples where you've seen dramatic improvements? Can you give some clinical examples?
Clinical example is one of the unbelievable. So first it's necessary to say, no two of autistic children or behavioral disorder children are the same. So one of my patients where the mother brought 4 years old, 2 brothers and 1 sister, triplets. But it was not identical triplets. Every egg was different. So 3 eggs. And all 3 autistic.
All 3, that's
4 years. No one worked until these 4 years. So we started with supplementation. Of course, the HRV was comparable with all the others. So low total power, low hormonal system, low energy, etc. Very high stress.
So that was common to all.
Yes, yes. In 3 months, the girls start to speak. They came to control every 3 months. Is controlled as biorhythms. She started within these 3 months already started to speak. It was not possible to stop her. It was permanently speaking. Very good behavior without any problem. She came, of course, first examination was with big problem, yes, because moving, fighting us and so on. Now she came, she gave alone the electrodes on the hands and sitting quietly. So it was, the mother was absolutely crazy from that. 4 years, no word, and now headache from the sleep. So it was so after that, of course, the mother started to. She came with some. She was afraid if it is useful to give money for this and so on. Everybody is critical to this supplement. But after that, she starts to believe, to trust to this, because it was unbelievable effect. In 1 year, the first boy, was able to speak and very good in school social behavior, and but the last one, it was the worst case. It was taking around another 2 years, so 3 years. When going to school at 7, it was postponed, enter to school. So at 7 he was okay to enter the school, but the other two, it was absolutely normal.
Yeah.
So it is really interesting. It is one of my cases which was possible to see, like it is like disruption. Yes, one by one, still improving. So it was very good.
And as you're rightly illustrating there, not everyone, even from the same family, responds in the same way.
Absolutely different. Yes,
Yeah.
absolutely different.
Well, thank you, Michael. There you have it. Michael is doing some absolutely tremendous work in mitochondrial medicine in support of autistic people, children in particular. And we're very happy that he's now bringing this work, this autism clinic support to the UK. So thank you again, Michael.
Thank you.
A pleasure to talk to and interview, and keep up the good work.
Looking forward to. Well.